Hi everyone, this is Mr. Neil Reiter, consultant audiologist and director of ClearWax. Thank you for joining me in another demonstration video of our recently developed WAXscope, which we hope to be launching in early autumn 2022. And we have here a patient who is also a hearing aid wearer, and they're experiencing feedback from their hearing aid due to the wax. And this is their left ear. So the wax is quite dry and higher composition of keratin in this wax, and it's impacted. You can probably see just above where the suction probe is right now, there's an indentation, the wax goes in, and the patient has got a receiver in the ear canal hearing aid to the dome. It's just pushing the core, the middle section of the wax deeper, similar to what a cotton bud will do, if truth be told. And because it's really dry and crusted, I've just put some olive oil spray in here. This just helps loosen this wax and keratin. And the secret here is to kind of release this from the canal wall. And so we're just at the base. We're going to be really gentle because we don't know really where the canal wall is here. So we're going to just hover over this wax and keratin. We don't want to scratch or abrade the ear canal. And you can start, now we can see a bit of the ear canal. You can see the pink flesh there. So it gives us, that works as a guide. We've got a better idea of where the canal wall is now. So we can better judge where to peel. So I've loosened that plug. That's come out in a nice big piece. So still blocked on anteriorly, so to the front part, probably mid-canal. But you can see the posterior aspect of the eardrum in the distance. So again, just peeling this away from the front part of the ear canal. And just hovering over the canal wall. And you can see the skin adhesions here. You can actually see the hairs in the wax and the skin. And there's some keratin here now. There's always a bit of a blind spot in our ears. So when we enter this, in the case of the left ear, which we're in now, so as you enter to the right, so posteriorly, there's always a little hidden area. Even with an endoscope, sometimes it's easy to miss. And you'll see that in a minute. So I'm just going to adjust the focus. So you can see the whole eardrum, and you can just see how clear the capillaries and blood vessels are there. So again, I'm just adjusting the focus to get them really illuminated. Just checking the attic regions. Probably the most important part of the eardrum that we always want to examine is the attic. So you'll see now, I'm just going to stretch the cartilage just near the entrance. And we couldn't see this before. And although it's not going to affect the hearing, it can interfere with their hearing aid. Because as they're inserting the hearing aid, the dome will may come in contact with this wax and skin, and then block the dome and lead to more feedback, and then block the filter. So this is quite stubborn, it's really adhered. So again, just want to lift up and out of this little trench there. I'm just trying to lift away. It's never possible to get every little last speck out, but if we can get the big mass out, that's really going to help the patient. I've got quite a bendy ear actually. See, we're just teasing this and manipulating this away, and we managed to get that out. I'm just going to re-enter the ear. Just examine the eardrum once more. Just adjusting the focus there. You can really see the blood vessels and capillaries. Attic's clear. And onto the right ear. Now in the right ear, I put some olive oil in straight away, but it helped. You can see there's a little puddle of olive oil in the distance, and that's on the eardrum. And we're going to have to go back and remove that for the patient. So the olive oil, as I use in the left ear, the olive oil didn't... we managed to remove all that out, and whilst doing the procedure, and the oil itself didn't creep in behind the wax, and it didn't lodge in the inferior recess. So we're going to come back for that. But just like the right side, and this wax, it's non-occluding, but once more, it can interfere with the patient's hearing aid. So I just want to remove this. So as they insert the hearing aid, it's going to graze and lodge. You can see it right at the base of the ear canal here. Near the entrance, you can just see the cilia there, the outer ear hairs. They shouldn't, for viewers and subscribers of the channel who are non-audiologists, these hairs, when we say outer hairs, shouldn't be mistaken for the outer hair cells. So the outer hair cells are the sensory portion in our organ of hearing. So these little hair cells, you may have heard of them before, in response to sound, these hair cells, they shear to one side, and when they shear to one side, there's a lot of chemical changes that occur within the hair cell, which then in turn produce an electrical signal which is sent to the brain. We process that as sound. So quite often when patients come, they've been obviously reading and watching the videos, and just have to clarify. So these hairs that I mentioned on the ear canal, they are not sensory hairs. They're just normal hairs, really. But the hair cells in the organ of hearing, the cochlea, we call them the outer hair cells, and there's also some inner hair cells. So if I don't use the word cells, it just means hairs in the ear. So more or less remove this. Again, in this blind spot, it's a bit more tougher skin. We're just trying to see if we can get a bit more out for the patient, but we don't want to graze the canal or cause any injury. I'm pretty pleased with that. You just see the clarity, we can see the sucker. And we're going to have to try and get this oiled out now. You can see it's settled at the bottom. Initially, it was a bit of air bubbles in there. When we squirt, so we're using a spray, so when you squirt it, you do get some air bubbles in there. And just at the bottom, you see it's a darker, almost like a vignetting, I think they call it in photography, when you get kind of like a shadow around the edge. So I'm using the fine end suction probe. You can see the oil. You can even see the some skin just swirling around there, some debris within the oil. So we're just collecting that. So we're in the inferior recess. By the way, I'm using the 4.25mm speculae. This is probably going to be the most commonly used specula once we launch. There is a smaller one, a 3.5, and a couple of larger ones. Let's see, really got all that oil out. Really pleased with that. Nice, healthy eardrum. So although we got this in focus, the blood vessels here, you can see they're not as prominent or as bulged as they were on the left side, but a stunning view of the patient's ear. The attic's clear, there's no retraction there. And I hope you enjoyed that video, guys. And if you are interested in the WAXscope, please do register your interest by emailing info@clearwax.co.uk. Thank you, bye.